Welcome to Dental Notes and Mnemonics. Today we are going to discuss about dental suturing. The most common method of wound closure is sutures, or in layman term we also call them stitches, which are used for both superficial and deep injuries. Imagine you are repairing a torn fabric. If you stitch it properly, the fabric holds together, but if the stitches are loose or uneven, the tear worsens. The same applies to the sutures in oral surgery. Suturing is the process of wound closure by holding the edges of wound together using a thread. This thread called a suture. The other material which are used for wound closure are staples, skin glue, adhesive tapes, strips to bring the edges together and promote the healing. But the most commonly which we use are the sutures. Sutures may be used not only to approximate the tissues but to ligate the blood vessels after surgery. Surgical sutures trace back to ancient civilizations, with India's Sushruta detailing wound closure using threads and even ant heads in Sushruta Samhita. Egyptians and Greek used flax and gut, while Romans refined techniques further. The Middle Ages saw catgut's rise, and 19th century introduced sterilization with materials like silk and silver wire. The 20th century brought synthetic options like nylon, and today smart, biodegradable, and antibacterial sutures are shaping the future of wound healing. The goals of effective suturing are to secure closed wounds, minimize infection by eliminating dead space, promote faster healing through primary indentation, maintain hemostasis, support tissue alignment, reduce pain, and prevent bone exposure. A good suture material balances strength, flexibility, and biocompatibility. It must hold tissue firmly, dissolve or remain as needed, resist infection, and minimize irritation or any allergic reaction. Suture material has mainly two components. The first is the thread, which is also known as the filament, and second is needle. The filament is the main material used to hold the tissues. It may be of silk, nylon, or vicryl. Needle is attached to the thread to help it to pass through the tissues. And sometimes there is the presence of coating as well. It may be made up of wax or silicone, and it improves handling and reduces tissue drag. Suture needle has three parts. First is a point or tip. This is the part that enters the tissues, and it determines how the needle pierces the tissue. Second part is the body of the needle or shaft. It is the middle portion of needle, and it provides strength grip for the needle holder. The end where the suture material is attached is known as eye. Surgical needles come with various point types, each suited for specific tissues. Cutting needles have a sharp triangular tip that easily penetrates tough tissues like skin. Reverse cutting edges feature the cutting edge at the outer curve, offer great strength and minimizes the risk of tissue tearing. This type is most commonly used for dental purposes. Taper needles have a round body that gently spreads through soft tissues such as muscle or subcutaneous layers, causing minimal trauma. Blunt needles, which have rounded tips, are designed for fragile tissues like liver or spleen, reducing the chances of accidental tearing or injury. The needle body is the widest portion of the needle. It is also called the grasping area and the gripping area. It is held by a needle holder, provides strength and control. On the basis of the shape of the needle body, it may be straight or curved. Straight needle body is like a swing needle machine. It is used in the area easily accessible, and curved needle is used in deep or restricted areas. Curved needles are classified by the portion of a full circle they represent. 1 by 4 circle represents 90 degree of full circle. 3 by 8 circle, it represents 135 of a full circle. 1 by 2 circle covers 180 degree of a full circle, and 5 by 8 circle covers 225 degree of a full circle. These measurements help in selecting the right curvature for different surgical depths and angles. In dentistry, we most commonly use 3 by 8 circle with reverse cutting edge. However, 1 by 2 circle needle is sometimes preferred where the working space is restricted, such as maxillary posterior region. The length of the needle is the distance along the needle's arc from the swage to the point. Swage we'll be discussing later on. Chord length is the straight line measurement from the swage point determining the width of the tissue bite. The length from the center of needle's curvature to its body is its radius. Needle diameter is measured in 1 by 1000 of an inch. With smaller diameter require less force and causing less tissue trauma during passage. Needles are classified by the way thread attaches. Eyed needles have a hole where the suture is manually inserted. It often causes more tissue damage due to double thread width, hence they are considered traumatic. In contrast, swage needle or eyeless needles come with the suture pre-attached, creating a smooth single diameter transition that minimizes tissue trauma, making them atraumatic and more commonly used in modern surgical practices. Good suturing needle should be made up of strong stainless steel so it does not bend or break. It should be thin as possible to avoid hurting the tissues too much. It needs to go in smoothly without causing any damage. It should stay steady in the needle holder, be super sharp to go in easily, and of course be clean and rust proof so there is no risk of infection. These slides are summarizing whatever we have learned till now. You may pause the video here and take a screenshot. So now moving to suture thread. Suture thread comes in different types depending on where and how they are used. There are two main types, absorbable or non-absorbable. Absorbable sutures dissolve on their own inside the body, so they don't need to be removed. This is helpful for deeper cuts or internal surgeries. The big advantage is that the patient does not need to come back to get them taken out. Non-absorbable sutures stay in place and need to be removed by a doctor later on. They are strong and often used on skins where the strength and support are needed for longer. Suture can also be made from natural materials like silk or catgut. Natural sutures are usually gentle on tissues. On the other hand, synthetic sutures like nylon or vicryl are very predictable and causes less reaction in the body, which is good for healing. The natural and synthetic material can also be absorbable or non-absorbable. Based on structure, monofilament sutures are smooth, single-stranded. They slide easily through the tissues and have less chance of infection. On the other hand, multi-filament sutures, which are braided threads, are easier to handle and tie securely, which saves time during surgery. When we talk about suture gauge, we really talking about how thick or thin the suture thread is. The size is written using the numbers 30, 40 or 5 zeros. It might seem confusing at first, but here is a key. The more the zeros, the thinner the suture. So for example, 50 suture is thinner and finer than 30 and having less tensile strength as comparison to the suture with the 3 zeros. In dentistry, the most commonly used sizes are 30, 40, 50. A 30 suture is thicker and gives stronger support, which makes it great for areas like back of the mouth or for wisdom tooth extraction. A 40 suture is a bit thinner and it is often used in general oral surgeries. 50 is very fine, used for delicate areas where you want minimal scarring, like in front gums or during periodontal procedures. So the choice of suture gauge depends on the balance between strength and sensitivity. Thicker sutures are stronger, but thinner ones are gentle on tissues and leave better cosmetic result. Proper suture selection is an essential skill in clinical practice. It directly influences wound healing, scar formation, and patient comfort. But how do we decide which suture to use? Let's break it down step by step. The first step is look at the wound characteristic. Where is the wound? If it is on the face, we go for finer sutures to ensure better cosmetic healing. If it is in deeper wound, we will need a stronger sutures for better support. The wound. Superficial wounds can be closed with simple monofilament sutures, and deeper wounds need a layered closure using absorbable sutures from the inside. Is the wound under tension? High tension areas like joints or the back. In that case, we use non-absorbable or reinforced sutures to prevent wound dehiscence. Second step is choose the suture material. We broadly have two options: absorbable like vicryl or chromic gut. These dissolve over a period of time, making them ideal for fast healing areas like internal tissues or mucosa. Non-absorbable sutures like nylon or silk, they stay in body longer, are best for external skin closure or slow healing wounds. Third step is to select the suture size in needle. Suture sizes are written as numbers. Here is the rule: the more zeros, the thinner suture. We have already discussed it. Delicate areas like face, use 60 or 50. For scalp or trunk, go with 30 or 40 suture number. For deep or high tension wounds, use 20 or thicker. Cutting needle is indicated for the skin. It slices through tough tissues, and a tapered needle for internal soft tissues, as it is gentle and more rounded. Patient factors also affect the choice of selection of sutures. In children, choose finer sutures to reduce scarring. In the elderly, offer stronger sutures to protect fragile skin. For slow healing, like in diabetes or smokers, non-absorbable sutures are often better. Always check allergy history. Avoid silk or gut in sensitive patients. Whenever we see a suture packet, it gives us all the information about that suture. First, it tells the name of the suture material like silk, vicryl, nylon, or catgut. Then the size of the suture is mentioned like 30, 40, or 50, which tells us how thick or thin the suture thread is. The packet also shows the type of needles attached, whether it is round cutting or reverse cutting, and what is the length of the thread, like 45 centimeter or 75 centimeter. And very importantly, it tells us whether the suture is absorbable, which means that it can dissolve inside the body, or non-absorbable, which means it has to be removed later on. The packet always mentions the word sterile, which means the suture is free from any germs and safe to use. It also has an expiry date, which tells us till when we can use the suture safely. Finally, a badge number or the lot number is written for record keeping. So before using any suture, we must always check all these details properly to ensure patient safety. So with this, we have reached the end of the video. Hope you like the video. Please subscribe to the channel. See you in the next video. Till then, bye bye. Take care. Have a nice day.